First of all, hello, good evening, and a very warm welcome to all of you. Thanks a lot for joining us tonight, joining on time, and participating in this special session that we are having tonight. So, just to give you a bit of context, the host for tonight's session is Warriors Connect, and basically, Warriors Connect is a community meant for people who are living with mental health conditions and their caregivers to find each other and support each other with empathy, to share their experiences, share their ups and downs. It is not a place where there are any professionals to give advice. So it's a place where we very much honor and respect the kind of prescriptions, medication that we're getting from our doctors and the therapy that we're getting. For us, it's more of sharing and learning from each other, coping mechanisms, and how to go through life. So it's a peer support community, and everyone who's in our community is already getting treatment from a psychiatrist for a mental health condition. So I'm Avni. I'm the founder of this community. And I'm proud to tell you that we are almost 140, 150 members today in Warriors Connect, and we engage on a daily basis, on real time through chats. We have weekly meetings, online mostly, and sometimes in person. We do monthly. And we also have a repository where we've stored important, peer recommendations and other things that we have done in the past. So today is the example of an event where I did not keep it restricted only to our Warriors Connect members, because I thought others will also benefit for it. But we have a variety of other kinds of things we do, which are only for our members. So today, the sort of session that we are having is called Ask Me Anything, because it is an interactive question and answer session that we will have with our guest for tonight, who is Dr. Vishal Chhabra. Dr. Vishal, if possible, would you be able to share your video? Yeah. Okay, great. So, Dr. Chhabra is a very senior psychiatrist. He has over 23 years of clinical practice, I think. So his experience is vast. And currently, he's presiding over the Delhi Psychiatric Association also. So he has a private practice in Delhi in Rohini, and also he is a consultant psychiatrist for Fortis hospitals in various locations. But I must say that apart from this, Dr. Chhabra has a very comprehensive approach to the treatment of mental health conditions, because, you know, clinical expertise aside, he is also a great mental health advocate. You should check out his Instagram page and see, actually, he goes live also several times. He has initiated several online and offline programs for the community to raise awareness, to reduce the stigma, just to like impart the right kind of information and education that is needed in our community today. So it's really great, Dr. Vishal, how you are supporting people living with mental health issues outside of your clinic as well. So really, we would like to thank you for that. And I know today is one more such effort of yours. So before I go into the logistics of how the question answer will be done, I would request you to give some opening remarks, if possible.
Mental is something everybody can and wants to talk about. Not everybody wants to talk about liver or kidney or skin. Very few people have expertise in that. But mental health is something which everybody feels they have a stake in, and everybody wants to partake in it. And everybody has their own opinions. And in social media times, we see opinions flying around everywhere, right? The problem happens when we don't know which one is the right opinion, which one may not be the right opinion. So how do we find out, how do we differentiate which is the good information for us to grasp and to apply or to understand, and which is just bogus or just marketing trick or just scaremongering? We don't know. I think that is the biggest challenge in today's world. We all need to be learning to understand how to do it. And I think that's where people like me should come forward and talk. Because there are a lot of so-called experts who are not experts at all, and they think because of some experience here and there, they think they become mental health experts, and that's not right. So, especially when you're talking about serious mental health problems, so I think it's important that professionals who have done degrees and who have experience, they should come forward, take out time from the clinical practice, and do these kind of forum. And it's better that people like you do this. So I think what we need is we need so if I'm talking to another psychiatrist, people don't maybe understand that information, maybe because it may be more too much jargon or too much complicated. But अगर आप लोग पूछते हैं from your experience, you want to know, understand, I think that is much better, and it is also for me also it's easier and better for me also. It's a learning experience. कि आप what do you guys face, and what are the problems you think, because you're seeing from different level, and how I can help you. So I think it's a very win-win situation for everyone. So I'm very glad I'm doing this. I'm very looking forward to it, and I hope this is not the only one I do with you.
I hope
Even
so.
if even before we started it, I'm just saying it. I'm hoping for
Okay.
more of this.
Okay, thank you so much, Dr. Chabra. You've set the context for this session as well, and why this Ask Me Anything sort of session is important. Of course, you are devoting 1 hour of your time. That itself is a good enough reason. But given the context of a lot of people here who are already having psychiatrists and therapists, like they have their own mental health professionals, including myself, I will
Mhm.
still say that there are so many answers that remain in the back of my head. I can't possibly tackle them all in the consultations that I
Right,
have. Not all of them are urgent, pressing matters, right, which need
right.
to be addressed in consultation. So it's great to have another perspective. And, because otherwise, a lot of us will turn to Google, and then Dr. Google will misguide us or confuse
Mm,
us, right? Or it'll have us all thinking that everything wrong that there is, that it's happening with us. So we are all hypochondriacs after that. But thankfully, if you have access to peers, like in Warriors Connect, we talk to each other. I think experience from a peer is a better bet. But there are so many things which is beyond the scope of peer support. So even however much experience we may have, we
mm,
end up
mm.
saying that you must go talk to your doctor about this, or you
Right,
must get a second opinion or something like that. So I think we should grab that opportunity here.
right.
And without further ado, let's just try to do that and get as many questions as possible. So the first question is there a way in which a lay person can distinguish between temper or teenage tantrums versus mental illness?
Mm. Versus teenage.
So how do you distinguish between, is this just a temper tantrums of teenagers, or is this could be a, mental illness?
Mm. So I think I'll try. So it's a good question because it'll help me take you to the basics of mental health. What is a mental illness? How do you define a mental illness? It's and the complexity of defining a mental illness. So the current construct of mental illness we have is more nosological. So it's a collection of signs and symptoms observed in many people, and on based on that, we have classified mental health problems into various disorders. Few disorders definitely stand out, like schizophrenia or bipolar or OCD, but not every other disorder. So a lot of disorders have a lot of, and even these disorders can have crossovers. So schizophrenia may have mood symptoms, moods disorder patients. So if you look, really, it's very complex because brain is very, very complex.
Mm-hmm.
However, for the layperson and for my also understanding, because that's the test I look at the disability associated with any problem. So, so if the Vishal is ill or Avni is ill, but Vishal and Avni are able to carry out the responsibilities perfectly, then maybe that illness which they are perceiving may not be really an illness. It could be just a discomfort or some kind of disease they are in. Not disease, but disease they are in, right? So, so if a temper tantrum, I mean, we all get temper tantrum. Anybody here who doesn't get a temper tantrum, please let me know. We all here get low mood. We all here get negative thoughts. worrying about our health, worrying about our relatives, uh, anxiety before a job interview, anxiety before an exam, anxiety before catching a flight. This happens to all of us at some level or another, at some degree or another. Important is dysfunction. So dysfunction is important. So let's say a teenager is having so much of temper tantrums that the child, the teenager, has got into trouble at school. So school authorities saying this guy is picking fights with every other boy or every other girl, whatever, and also answering back to teachers, misbehaving with teachers. So that becomes a dysfunction itself. That needs help. That needs help. But if a temper tantrum only with the dad or mom, on and off, because आप मुझे mobile नहीं दे रहे हो, you're not allowing me to play, you're not allowing me to stay with friends, maybe, and if it just is one off, once in a week, once in a month, then maybe that's not a dysfunction. So dysfunction is important. So this criteria teaching all of you to apply to all your friends, relatives, yourself when you try to when you're looking at a problem, whether you need help or not. So we all need help when you dysfunction. Because if I'm like yeah, 16, 17, 18, whatever people we have, one of us may have little headache, may have little toothache, may have some maybe some acidity issue, some gas issue, something. But we're not going to doctor for it because they are not that dysfunctional. But if it was, we won't be sitting here. We would probably be asking for that help. So I think this is how we need to live. Some events, some anxiety events, on and off, which is not causing dysfunction, should not be looked so seriously. Okay.
Okay.
But I mean, again, there are layers to this answer. I can go further. If anybody is watching it later, says maybe no, Dr. Vishal is wrong. What if I am not able to go into a lift at all? That's a once in a while, situation. But that's a phobia. Then you need help, and if you want help for that, so it can get more layered. What if? But I don't want to get into that because that'll complicate. But mostly, if you look broadly, is the dysfunction associated with it. So the dysfunction at the level of, I forgot to mention. So the dysfunction at the level of society, fighting with other people, in this example, or dysfunction at level of family or work. You know, maybe you can club society with work, maybe you club family with work. It depends. So dysfunction, that means the person is having anger issues with the family members, and it is causing a lot of problem in the family, or it is having too much. It is having a lot of problem in the school. So it is a teenager. I'm assuming he's in school, he or her, or the person very upset with himself or herself. So the child is trying to harm himself or herself, expressing to death wishes, suicide ideas. Then in anger also. So dysfunction ho raha hai, then we need help. I think that's what we need to look at.
So, first of all, I've got the question regarding workplaces, which I think is extremely important. So, we have a member who has bipolar disorder, right? Has experienced a mania many times and all. She has a history of losing job 5 times and not being consistent in freelancing as well. So, she is struggling to choose one option as her career, So, what advice do you have for her?
So she has lost a lot of jobs, huh? Because of the mood issue.
Yes.
Um, so I think so again, the it is very we need to look at in more details in terms of the personality of the individual. That person is more creative or
Hmm.
more right minded or more logical, left minded. So one is that. Second, we should try and see if we can help reduce the number of mood episodes. Is she taking the medicines regularly? Because end of the day, we have to also take care of no matter how good a job is or how supportive the employers are, or even if it's your own work, if the mood is not stable, it'll be difficult to, sustain that job again and again.
Yeah.
That, so we need to make sure that medicine is much more regular, much more clear. Again, a sub layer to that is finding the early relapse signs and acting on it immediately, not waiting for. So, because in bipolar, 1 week is a long time if somebody is having a lot of episodes. So, just a day or 2 days of poor sleep is enough to trigger mania. So we should take immediate action and take extra medicine for sleep or talk to the doctor immediately and make the medicines changed. I think that's what we need to look at. So that is the second. Third, I would like to look at any comorbid problem. And my understanding is a lot of time people when they change jobs, they may be suffering from attention deficit issues. So they're not able to sustain the job because they get bored and they're not able to concentrate. So let's look at that also. We should also look at any cognitive deficit. There's any memory issues, which is again making it difficult for the person. So you understand. So I'm trying to look at it multiple levels, and that's
Mm.
how actually that's a psychiatrist complex. People think it's easy. The answers are not easy.
Yeah.
If you look carefully, a psychiatrist like me, a doctor who's careful, he's looking at it all this stuff while talking to the patient. Patient doesn't realize it. They think it's very simple.
Mm.
Medicine ऊपर नीचे कर दी, but it's not that just medicines. There's a lot more stuff which is happening in our mind when we're looking. So these are the four layers at least I can think of right now we should look at. So freelancing or not, again, so maybe freelancing if that works out for you. Uh, but I think this we needed to look at it much more deeper detail before we answer this question.
Right, right. I think I know about the case. So there has been mania, basically. Manic episodes have, been a issue. And the main purpose of wanting to pursue jobs in spite of stability not being there is financial constraints. So I think that
Mhm.
is where this question is coming
So
from.
if you know this case that way, so we should again stabilize the meaning. So maybe one mood stabilizer is not enough. We need to do two, maybe three. Sometimes we need even three mood stabilizers. Because that is causing a lot of disruption. If it is a minor mood episode, not causing much disruption, that would have been okay. But this is causing major disruption to the person. So we should try and regulate it much more harder. Also, we need to give her or him an employment which is not too heavy on the mind. No night shifts at all.
Mm,
Early, good sleep routine is very, very important. Bipolar. A
yeah.
good sleep is very, very important. And also mindful of the biorhythms, of the weather rhythms, weather patterns. That is also very, very important. So again, a lot of layers to it.
I would like to take up a common theme which people have mentioned about remission. Okay,
Mm-hmm.
so one person who is a caregiver to her son having schizophrenia says that he is on clozapine. So first of all, Dr. Chabra, we don't actually take names of medications and talk about medications on Warriors Connect because we are not
Okay.
professionals and I discourage that. However, since you are here and you are a professional, so I'm okay taking these names with the whole disclaimer that everyone's prescription is highly customized. No need to compare one drug will work for someone and not work for the other one.
True. 100%. 100%. That is very true. And it's
Right.
very dangerous to read about all that on the net because net is very, very deceptive about this.
Absolutely. Right. So she says, my son is on clozapine 62.5 milligrams since June. His symptoms have reduced completely. Can it be called remission? What might be a further journey? And a related question from another person who's a caregiver for son, I think. Uh, his son is doing good now after recovering from the mental illness, but his doubt is regarding weaning of medicines. How to prepare him for a job? Like it's about the end. Like how do you know the end is there, whether or not?
See, I will also tell you my bias because all doctors have their own bias. I mean, every human being is biased. My bias when patient comes to me, I want to always reduce their medicine.
Mm.
I start with some medicines, I build up, I stabilize the patient. Then my tendency is always to reduce. If you look at the psychiatric textbooks, most of the times they tell you not to reduce any medicines, continue the same. I
Mhm.
feel that's been very impractical because a lot of times uh, patients get bored or and they will drop off or they will not take. So we need to engage the patient.
Mhm.
And you tell somebody who's 18-year-old, yeah, you have to take medicine all life. It's not an easy thing to hear. You know,
Mhm.
I think so. I think it's important. So I always try to reduce them. But in certain situations, I've burned my hands repeatedly, but I still try. You can't reduce. The moment you reduce too much, people keep relapsing. So bipolar is one, schizophrenia is one. Also in OCD, this happens. Also in recurrent depressive disorder, this happens. So So the moment you reduce them, or you stop them, actually, when you stop the medicines, because the problem is also social. People once diagnosed with thyroid will continue to take thyroid medicines for lifelong. People once diagnosed with hypertension will continue to take it lifelong without asking. And people don't read the side effects of those medicines. If you read, they're also not. You'll also find a lot of dangerous side effects. Same with
Yeah.
the diabetes. But everybody wants to stop psychiatric medicine because you feel you don't you don't need help for it. I mean, I'm okay now. I mean, why do I need this? But they don't say this to about their pancreas, or they don't say this about their heart. That is the bias
Mm.
also of the individuals, of the people, of the society. I think people should accept that certain times we can't stop the medicine, but does not stop you from working. That does not stop you from marrying at times when you're stabilized. That does not stop you from having children. People think because they have these medicines, they can't marry, they can't have children, and all that stuff. But that's not true. That doesn't happen with all. Some patients, obviously, who are very severe, may not be fit to get married, may be fit to have children. Possible, but a lot of people do. Okay, so I think people unconsciously think like this. Yeah, until we stop the medicine, we are not all right. If you
Mm.
have symptom, if you're not symptomatic now, if you're in remission, please continue the treatment. I think you're lucky. A lot of patients don't get remission, especially in schizophrenia, especially in bipolar. So please continue it. And we can reduce, and we should then think of managing the side effects. Also, do not, especially for schizophrenia, because schizophrenia damages the cognition. Don't look for very high end, high pressure jobs. It's not a, it's not very fruitful in long because it affects the brain. We all are stressed in today's world because everything is cognitive. There was a study done in three developed and three developing countries. This is 30, 40 years ago. And it was a shocking result on schizophrenia. So there were three centers in India also. They found the schizophrenic patients had better outcome in India. There were hardly any medicines than in Western countries. There was hardly any psychiatrists, hardly any hospitals. But the schizophrenics had better outcome in India, better outcome, I think, in other two developing than in Western countries. Why? Because the type of jobs we were doing in India was more agricultural job, basically agriculture. So for a schizophrenic to work in a farm is much easier than to work in a bank. There's so much pressure, right? So schizophrenic to maybe run a general store is easier than running maybe an engineering firm. You know, so I think what is important is for us to realize that if if a person has a mental health problem, especially which is affecting the cognition, it's better to take up a lifestyle or a job which is not so straining for the mind. I think that's what we need to understand and look at. I'm nowhere discouraging people because this is a very small portion of the patients who have mental health who recommending this. Most of the patients who have mental health problem in today's world do get better and go back to do their job. So most of my patients are IT professionals, they're doctors, they're engineers, they're lawyers, they're IAS officials. They're all doing their jobs. But where you have a severe schizophrenia, a severe OCD, a severe bipolar, a severe depression, maybe not they're not able to actually hold on to the job. That becomes very difficult actually. So better to take those jobs which are more labor intensive, more physical work intensive, not brain, so that it's easier to engage them and stay extra. I hope that makes sense.
Mhm. I've learned it from my own experience the hard way that, used to be very concerned about the number of medications I take at a young age and comparing myself to everybody, then comparing my earning to everyone else, etc., etc. Lots of stress, lots of comparisons. So I made my peace with the fact that what my goal is to be symptom free, not medication free. So
Perfect.
still,
That's beautiful. Let me write. That is very nice. Yeah. My goal is to be simple. Yeah, that is very nice.
yeah, I mean, I still want that my medicines can get calibrated, but yeah,
Yeah,
ideally,
yeah.
even if I have that feeling that I will have to take it lifelong, but I'm okay with it. And I want to adapt my lifestyle accordingly. That part is also tough. How to build a lifestyle which is fulfilling and yet, not crushing. I think it takes some time to figure out, what you are
Yeah,
satisfied with and what you can
yeah,
do, how you can live up to your own, how can you play to your strengths while recognizing limitations. So this part has been very, very tough for me as a person. And because
yeah,
we were discussing, sir, about the, person who was in remission and all that, actually, that was a case of, it was a spectrum of autism or OCD with depression, perhaps schizophrenic. So perhaps the diagnosis was a little uh,
yeah.
fluid.
So yeah, and that can all that also and that complicates the situation because um, our diagnoses do get fluid. They are not silos. So somebody once diagnosed schizophrenia can't have OCD. They can have OCD. They can also have depression. They can have bipolar symptoms. That is true. That is true. So that becomes more tougher. But these are the general principles I'm talking about. I think that makes more
Sense.
sense in my
Yeah.
experience. So you have to be less idealistic and more practical in these issues. Idealistically, I can talk a lot of stuff here, but that will not be practically, and that's a problem. That's a problem.
Mhm.
You can't write this in a book, which I'm writing right now, because when you write books, when you write guidelines, when you write all those things, you write much more superfluous things. You write much more, theoretical stuff. Life is
Mhm.
not like that. Life doesn't work like this. I'm
Right.
afraid of that.
Right. So, sir, just as a continuation, although this question has come late, but it is a continuation of what you mentioned as cognition difficulties. So, one member is asking what kind of steps can be taken for it. She has BPAD2 and chronic pain, which is fibromyalgia, and also mild ADHD. So, she has difficulty recalling names and words. So, can we do something at our end?
Yes. So one, in terms of medication, we need to look at what medicines we can give to improve the memory and concentration of that individual. So we should look at this one. Second, have a very healthy lifestyle that most importantly includes good sleep, a good, healthy, nutritious diet, a good exercise. They all help the brain. Uh, Removing negativity and toxicity from the life. So if you want to watch content, watch positive content, listen to good and positive stuff. And you also do a lot of, there are a lot of memory games, a lot of puzzles available online. Well, there are, if you look at any, whether you go to Play Store or App Store, you have this, like games like Elevate, who
Mm.
they'll helps you hone your skills, hone your cognition. I think that memory games or cognitive games you can play. That's what I think you can do.
Okay. Yes, I also try to do that. We shared some names on Warriors Connect, like puzzle pages, which I do every
Hmm.
day. I try to learn chess, but I didn't manage. Uh,
Crossword board. So all
yeah.
that way, I mean, it's not that, I mean,
She's, hmm.
we all are suffering memory loss and all suffering concentration because of the lifestyle we're in. It's really, really hectic paced lifestyle, very hectic. I mean, I
Right.
thought I would meditate before sitting with you, to be really frank. I, I got a call even at the last minute before, and I had to say, please, I can't talk to you right now because the patient said, I'm in a hurry. I said, I need to speak to these people.
Hmm.
So, because of the fast paced life we are in, it becomes very difficult actually. And so, mind is always over occupied. And because
Hmm.
the mind is always over occupied, or overburdened with so much of information, even
Hmm.
if it's an entertainment is also a lot of information.
Hmm. Yeah.
Doesn't have enough space to breathe, and that's why we also find cognitive issues. That also become an issue.
Right. 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 Yeah. So I think she is saying that she plays many puzzles, crossword,
Yeah, I
board.
saw that.
I think
Yeah.
she's doing her bit.
So
Uh,
sleep, then sleep, good diet, exercise, physical exercise. For mental health patients, physical exercise is much more important. People don't realize that.
okay. Okay. So then, sir, there are questions about weight gain. So
Yeah, weight gain.
I'll
Yeah.
just
So please tell. What are the concerns? Yeah, tell me.
मेरा वेट बढ़ गया है मेरा सर्टालीन शायद 50 और लोराटिजोन 40 मिलीग्राम लेता हूँ।
Glycerin, glycerin. हाँ.
क्या इससे
मैं
वेट बढ़
इसको
है? And
हिंदी
then
में
there are
बोल रहे हैं,
others
हाँ,
also. हाँ,
राइट.
so वो आप हिंदी में भी बोल सकते हैं. And what if the medicines for schizophrenia cause weight gain? I think it's there that antipsychotics do.
या.
But how to deal with that is the question, I think. And हाँ, so sir, in this category, weight gain, these
सो
questions.
सो हम एक बात हमें ध्यान रखनी है. uh, ये there is a overlap of mental health problems with metabolic problems. तो वो
Hmm.
जीन्स अब धीरे धीरे पता लग रहा है, वो जीन्स इंटरप्ले भी करते हैं. तो लॉट ऑफ टाइम्स व्हेन पेशेंट्स हैव स्किज़ोफ्रेनिया, वो मेडिसिन ले रहे हैं, तो मेडिसिन से भूख बढ़ती है, वेट गेन बहुत ज्यादा बढ़ जाता है. ये देखा गया है. सो हमें उन मेडिसिन का ध्यान रखना. देयर आर मेडिसिन विच आर वेट न्यूट्रल, देयर आर मेडिसिन विच कॉज लॉट ऑफ वेट गेन, एंड देयर आर मेडिसिन विच कॉज सम वेट गेन. तो ये डॉक्टर पे डिपेंड करता है, और डॉक्टर को थोड़ा ध्यान रखना चाहिए. और बट ये भी डिपेंड करता है कि उस समय कंडीशन क्या है, कौन सी दवाई सूट करे. लेट्स से olanzapine, which is notorious for causing weight gain, but maybe some for some patient it suits them much more than maybe risperidone, which also causes weight gain but not as much as olanzapine. Aripiprazole, which causes less weight gain than these two, and very weight neutral actually, uh, takes time to act. तो तब तक शायद अगर पेशेंट इज वेरी साइकोटिक एजिटेटेड है, तो ये बैलेंस आउट करना पड़ता है. तो आप ऐसे पेशेंट को ओlanzapine या रिस्पेरिडोन पे शुरू करो, और धीरे से उसको एरिपीप्राजोल पे शिफ्ट करने की कोशिश करो. देयर आर आल्सो सम अदर मेडिसिन वी ट्राई टू रिड्यूस वेट. वो भी पॉसिबल है. यू कैन आल्सो टेक हेल्प ऑफ एंडोक्राइनोलॉजिस्ट. उनके पास भी मेडिसिन हैं टू हेल्प यू वेट गेन. यू कैन बी यू कैन आल्सो टेक ए डाइट प्लान एंड ट्राई एक्सरसाइज, जैसे मैं आपको बता रहा था, बहुत जरूरी है. इसलिए यूरासिडोन भी एक नई दवाई आई है, उतनी नई भी नहीं है, 5-6 साल हो गए हैं उसको आए हुए. अ, उसमें भी कई लोगों को वेट लॉस में फायदा होता है. इट्स नॉट वेरी वेट, इट डजंट कॉज, बट सम पीपल डू गेट वेट गेन विद इट. सम पीपल डू गेट वेट गेन विद इवन विद aripiprazole. Some people don't get weight gain with olanzapine, but mostly patients get weight gain with olanzapine, and mostly patients don't get weight gain with aripiprazole. But ये mostly का मतलब ये नहीं कि सब है. हमें ये याद रखना चाहिए, बायोलॉजी में, नेचर में हमेशा एक्सेप्शन है. हर चीज में एक्सेप्शन, हर चीज में. तो ये बहुत इंपॉर्टेंट है याद रखना. दैट्स वेरी इंपॉर्टेंट. सो आई थिंक आप अपने डॉक्टर से कंसल्ट करो, उन्हें बोलो कि सर मुझे मुझे सर या मैडम मुझे बहुत वेट गेन हो रहा है, प्लीज मेरी हेल्प करो, गिव मी समथिंग और शो मी अ वे टू रिड्यूस द वेट.
Mhm. Right. And of course, exercise and all that you've already said. अपने तरफ से तो है.
Exercise, diet, we should help them. Yeah, we should work on it.
So there is
Mm.
someone who says, and I think this is someone living with schizophrenia, but
Mhm.
what she's saying is that there is too much self-obsession to one's mental illness. So her own. Can it
ये बड़ा
also
अच्छा
be a
इंटरेस्टिंग है.
sign, can it also be a sign of over-obsession to mental illness, which is there but not to the extreme or so high? So can it be a sign of OCD thoughts? So this is, her own doubts. Hmm.
So अगर आप, so if you, what the person is saying that uh, if if the person is thinking about the illness all the time, है ना? That's what he's saying, right?
Yeah, obsessing over it all the time, thinking कि क्या मुझे OCD thoughts हो रहे हैं क्या, मतलब like that. I think
Uh,
it's a loop, right?
yes, I think it's not an OCD. So OCD के जो है ना, OCD बड़ा लूजली यूज करे. ऑब्सेसिव कंपल्सिव होता है, irrelevant, intrusive, रेपिटेटिव, ठीक है, बट बहुत सारे थॉट्स में रेपिटेटिव होते हैं. वो इंट्रूसिव भी हो सकते हैं, बट क्या वो इरेलीवेंट है? अगर आपको एक बड़ी बीमारी है और आप उसके बारे में सोच रहे लाइफ लॉन्ग आपको सफर करना है, तो मे बी दैट्स नॉट एन इरेलीवेंट थॉट, यू आर थिंकिंग अबाउट इट. इरेलीवेंट थॉट विल बी, जैसे मेरे पीछे पंखा है, वो गिर जाएगा मेरे ऊपर, पंखा गिर जाएगा, पंखा गिर जाएगा, ये थॉट आ रहा है मेरे ऊपर. अब उसका क्या मतलब है? कितनी बार पंखे गिरते हैं घरों में?
Right.
मतलब नहीं. बट मुझे आ जा रहा है, आई एम गेटिंग द थॉट अगेन अगेन अगेन. और आई एम गेटिंग अ थॉट, let me go wash my hand, let me go wash my hand when I'm sitting and talking to, मेरे हाथ गंदे हैं, go wash my hand. There's no law, I'm not going to eat anything. And then that thought is good. Then it becomes an obsessive thought. If I'm worried about my flight tomorrow morning, कि मुझे फ्लाइट है पकड़नी है, छूट तो नहीं जाएगी, छूट तो नहीं जाएगी, that is not an obsessive thought, that's an anxious thought. ये डिफरेंस है.
Right,
So
right.
आप अपने आप पे ज्यादा वरी ना करके you thank God. So what is one of the best exercises in life you do to uplift yourself, to upgrade yourself, which all religions teach you unconsciously. They also probably don't know.
Mm.
Is gratitude. So gratitude karo. I think it's important. Even no matter how severe an illness you have, if you gratitude, at least what I have a life, I've been given so much good. You don't have any physical illness, bigger physical illness. You have both eyes. You can see properly. You can walk properly. बहुत सारे लोग वो नहीं कर सकते. So gratitude about on your body, gratitude on what you have in your life, your people, gratitude of things you have in life, switches your mind away from all this stuff.
Of course.
वो रोज करना चाहिए. आप सबको gratitude करना चाहिए. So जब हम प्रे करते हैं भगवान को, तो लोग भगवान में क्या प्रे करने में गड़बड़ता क्या करते हैं? वो भगवान से मांगते रहते हैं. थैंक यू नहीं बोलते. तो इफ यू थैंक गॉड, इट्स बेटर.
Okay, sir, there is one question from someone about bipolar and love, which I think
हाँ.
is very, very relevant because, having relationships, marriages, whatever kind of romantic and even non-romantic relationships becomes hard, right? So the question is, I think, might be relevant for many, how to know whether one is in love or not, since I am bipolar, whether I'm in love or is it infatuation, because you tend to not trust your own self, right?
नहीं, हाँ, because if you're in a high state, everything is lovey, lovey, lovey dovey. You're feeling lovey, your libido is high, you feel
Mm,
love is all around you.
mm,
Um, I think that's a very good question. What we need to remember is, since you have that much insight already, so you already know that suppose you're bipolar, and you already know that insight. So when you're in mania, even though you're in that manic phase, sometimes people do have a tinge of insight ki beach beach mein ki that maybe I'm going high, or people are telling around the high, and also how the other person is responding to you, right? So even in life also, otherwise also, if you love someone and the other person not loving you back, then anyways, what can you do about it? Maybe you can love that person, but you can say I love that person, but the other person has to respond. And in a manic state, anyways, the manic mania don't last for a long time. Thankfully, it just lasts maybe for weeks or months, maybe maximum. The florid mania, the high mania doesn't last for more than in a month or two. Very, because it can be very damaging, disturbing. So नहीं होता, उसके बाद depression आ जाता है. But if you have hypomania, the hypomania can last for months together. पता भी नहीं लगता. That is popular. Then if you say that's an infatuation of love, that can be uh, decided depending on uh, uh, the response from the other person, from the other party, how they're responding to it. I think that is important to remember. And infatuation usually doesn't last for more than maybe a few weeks or maybe a month, and after it dies down. So I think that's what we should look at. But anyways, love is a complicated topic, not easy to answer.
Of course, of course. I think since I
There
also
are
have
many. Yeah, go ahead, please. You tell me.
Since I also have bipolar disorder, but the pattern is very different from this person. But still, I would say we keep become hyper vigilant. कि मैं hypomania तो मैं नहीं हूँ, मैं mania में तो नहीं जा रहा हूँ, and like that. But uh, what I would actually say is that you wait it out. Just
Yeah,
wait.
exactly. So true love lasts forever. True love है तो चलता ही रहेगा.
Hmm.
So
So don't.
don't be in a hurry to marry that person or propose to that person,
Mhm.
especially when you know. So if you're taking Valproate morning and night, or lithium morning and night, you're also taking quetiapine, you're also taking lorazepam, you're also feeling in love with that person. So थोड़ा calm down हो जाओ. I think that when the medicine settle down, you're going through high phase. I think that's a sign for you. Then you should be careful. Because even though you may love that person, even though the other person may love you, but here your behavior may turn that person off. Will be important.
Mhm. Yeah. And I think for all of us to have, it would be great if we all have somebody around us who can notice that we are going the highway and point that out. So the ones who live alone, it is difficult, but still, if there are some friends or somebody
And
who
that's why Warrior connected.
Warriors Connect is there, yes. You can mention that.
That's exactly right.
So one question is there from someone who has various sorts of conditions, but specifically borderline personality disorder. So she says, I am a young adult with multiple psychiatric illnesses, most
Borderline, I remember.
most notable being a patient of borderline personality disorder. I struggle with mood instabilities in terms
Mm,
of depressive episodes every few
mm,
months with
mm,
mild to moderate episodes. I
mm.
don't take any meds as of now, but managing on therapy. My question,
Management therapy.
huh,
Mm, mm.
my question, how do I manage my mood instabilities with my academics? It feels as if my emotions disrupt my life.
Yes,
I
yes. That's exactly why she should take medicines. That's my humble request to her.
question.
She doesn't have to take very high levels of medicine, but maybe a little low, dear. No
Yeah.
amount. Problem, but the problem क्या होती है? The problem is, again, this is a bias. Medication means I'm getting help from outside, I'm getting dependent on something. But therapy twice a week is not getting dependent on someone. That I don't understand. Because you feel the therapy is the person is teaching me, and then I will learn how to work on my emotions. But, the, there's so much a part of our brain which is not in our control. So many habits. Otherwise, also, normally in the day-to-day life, there's so many habits which are not in our control. I think so. I think it's important that you should start some kind of medication because it is causing a lot of. हमारी starting में बात हुई थी ना with disability, it's causing a lot of disruption. If it was a minor disruption, I wouldn't mind not taking medicine. A lot of borderline patients don't take medicine. But if it is causing some disruption in your routine, in your studies, in your whatever career, then do take some amount of medicines, please, and continue with the therapy. That's so I would strongly suggest that.
Yeah.
Also, uh, I mean, if theoretically I can say try and uh, analyze your emotions, be more of self-aware, all that stuff. But practically speaking, because it's not that easy, you just little medicine will help you,
Mm.
will help you tide over the crisis. And I think, and do not think it as you're getting dependent on it, just getting support. Like
Yeah.
this, like I was wearing glasses.
Hmm.
I don't need it now because it's for the far sight. But if I say, oh, I don't want to wear the glasses, okay, I go for LASIK, but LASIK doesn't work for everyone.
Mm.
What if I think this is a dependence for me and I keep cribbing about it? That's not good. But
Mm.
this is support. This is an external support. We all need this support. This is a support. Clothes. No, the animal wears it. We wear it. It's for our support, for comfort. So we should think of medicines. And medicines, I'm not saying go for medicines, but always take medicine. I'm not saying that. But where it is causing disruption, please think about it.
Yeah, absolutely. Because you mentioned anger issues and
Yeah.
familiarity
Yeah. Then
issues.
person goes through it ना उसके बाद उसको बुरा लगता है, guilt आता है, shame आता है, all that stuff happens. A
Mm.
lot of baggage which goes. It only adds, compounds the problem.
Right, right, right. So thank you for that. I will ask some questions that caregivers have been
Sure.
picking. I'll say one or two of them together if you don't mind, क्योंकि
Yeah,
ultimately
yeah, no.
crux वही है. I'm a caregiver for a friend who's schizophrenic. He is continuing to take medication. At
Mm,
times, it is very difficult to manage, especially when he is suicidal. He is refusing to go for therapy. Though I am managing to counsel him, I am worried about his suicidal thoughts. Is there a guideline on when should a rehab option be insisted? How
mm,
can I convince him to go for therapy or rehab? This थोड़ा
mm,
extreme case है. And there is another one who is saying that he's a caregiver to his wife who is suffering from depression.
mm,
And she is a headmistress in a school in another district, so it's kind of far.
mm,
Sometime her behavior is a little abnormal. She is taking
mm,
treatment at CK Birla Gurgaon. So this is
mm.
just like what are the do's and don'ts for a caregiver. So one side is depression, one side is schizophrenia. I know कहानी थोड़ी different हो सकती है.
हाँ जी, हाँ जी.
हाँ. So
So
if you
so I've seen my patient. So my patients of schizophrenia, once the schizophrenia settles down or calm or the psychotic symptoms reduce, a lot of times patients can have this feeling fateful. What is the point of this life? Or feeling upset or thinking again. I get voices again and again, and sometimes those voices don't go away. So voices are usually critical of that individual. abusing that person, saying that you're useless, कोई काम के नहीं है. That can uh, propel patients to go to the suicidal ideation. People think suicide is only for depression, but a good minority, I think up to 10% of schizophrenics attempt suicide. It's a very large number. Same as in borderline, sorry, bipolar. Bipolar also a good 10 to 20% attempt suicide. I'm not sure committing also, but attempt is at least you have tried harming themselves. So for this caregiver with schizophrenia, the red line will if the person is becoming very withdrawn, quiet, expressing suicidal ideations again. So they should consult the psychiatrist. If you say patient not ready to go because no insight, mana kar raha hai, then a forceful admission to a psychiatric facility is allowed under the law, and they should go ahead for the same. And there are ambulance service to pick them also from home and take them to the center. हो सकता है. And so if you're very, very worried about that person, please, that person needs proper treatment. So they should go. And for that patient who depression wala, मैंने भी देखा the question.
Do's and don'ts है basically for a caregiver. It's too
Uh-huh.
if it's too
Little
much.
abnormal. Yeah. So do's and don'ts में, so there's no clear, but again, any change from the whatever normal behavior, whatever the routine behavior that individual, you see any drastic change in sleep, in appetite, in behavior, in dressing, in anything, that is the red flag, and you should check that. You should be worried about it. You should get worried, and you should take action. Key whether the person, because one of the biggest problems in psychiatry in all things is compliance with medicines. Nobody wants to take medicine, so people skip. भूल जाते हैं. शादी आ गई, function आ गया, त्योहार आ गया, and you people keep skipping. And so initially, when the episode happens, family was very good. नहीं नहीं, doctor साहब, I will take care of the patient. I will give my kid अपने हाथों से दूंगा. A person do. But after over 1 month, 2 months, you get tired. You said, खुद ले तो रही है, ठीक है. The person is taking. And that's it. Person also, for some days they're taking, then they skip. Then the medicines भूल गए. अच्छा आज भूल गए. And that आज भूलना, कल भूलना, when it compounds, the person starts getting symptoms. Most of the time, the patient comes to who are stable, come to me, Dr. Vishal, they say symptom, this symptom, that symptom, this symptom. I said, सच सच बताना. I will not get angry with you because I've learned this art over time. कितने दिन से मेडिसिन खाई? एक हफ्ते से. Symptoms कब से? एक हफ्ते से. Please medicine start करो. That's it. If they would not tell me, what will happen is I'll double the dose and give them. They'll create more side effects. They'll create more resistance towards medicine. So
Yeah.
be truthful to the doctor. The doctor डांटता भी तो truthful हो. It's okay. We all miss medicines, but we need to tell. So I hope I've answered 2, 3 other things.
Yeah. I think we are trying to hardwire compliance into our members in Warriors Connect. But there's all sorts of bhayanak stories we have, right? Devastating outcomes of in cases when people have completely quit for a long time. So, yeah.
Yeah.
Of course, compliance is the main thing. So the mother with 2 children, and she's talking about lethargy. I think a related question is, when we are experiencing things like lethargy or pain or whatever, how do we know whether it's just that or if it's a depressive phase? Because ये doubt बहुत आता है. That are you just feeling a little low, or is it like a pain that is flaring
ठीक
up
है,
if
ठीक
you
है.
have chronic pain?
So, so for depression, depression, depression is a very commonly abused word. Everything. मैं depressed हूँ, मुझे anxious हूँ, मैं psychotic हूँ, तो psycho हो गया क्या? People use these kind of words. But when you say depression in a clinical sense, a person should again have dysfunction. The dysfunction word पे फिर आ रहा हूँ. So all of us do get tired. I had a very long day. After this, I will be tired. So we all get tired, and when you have 2 children who are not doing well and they need all the attention, we get tired. So you should take some time off to rejuvenate and relax yourself. But don't call yourself depressed person yet. For somebody to have depression, they should have low mood consistently most of the time or all the time for 2 weeks at least, along with lack of interest in doing any activity or daily activity. That's called anhedonia, or lack of energy, which is suffering. But throughout the day, almost feel like doing nothing, almost on the bed, along with crying spells, disturbed sleep, headache, pains, and aches. So that can happen. Random pains and aches which are happening, it happens for 2 3 days, you're better, then gone, then 2 3 days happen. That may not be depression. But again, what is the best way out of depression for this kind of chota mota depression with day to day? If you're a caregiver, meditate. Meditation is very nice. I think you should all meditate. Pranayam बहुत अच्छा रहता है. Pranayam is very good. Physical exercise, go for a walk. Music लगाया था, walk कर लिया. आपको अच्छा पॉडकास्ट सुन लो. बीमारियों की मत सुनना, बिकॉज बीमारी में हो, बीमारी की सुने जा रहे हो, बीमारी की बात करें, वो मत करो. वॉच. सो माई आई डोंट listen or watch psychiatry. I watch geopolitics or I watch technology or I just listen to something or watch sports to lighten up your mood. Life is, we should not take life so heavy. We should also take it a little light. I think that's important. So that is important to unwind yourself. If you feel you're having crying spells, if you feel you're feeling very depressed, you're feeling suicidal ideas, then you take help from a psychiatrist. बट अगर आपको थोड़ा बोरा हो रहा है, आप मैनेज कर रहे हो, डू कर, बिल्कुल करो. आई थिंक गुड नाइट स्लीप फॉर 4 5 6 days शुड बी एबल टू टेक केयर. बहुत बार मैं क्या करता हूँ, अपना प्रिस्क्रिप्शन के साइड में व्हेन आई सी केयर गिवर्स आर गेटिंग बर्नड आउट, मैं गोली लिख देता हूँ 2 4 दिन 10 दिन की. एंटी डिप्रेशन भी हो सकती है, एंग्जाइटिक भी हो सकती है, कि थोड़ी सी खिला दी 10 20 दिन, फिर वो बंद हो जाती है एंड दे बिकम ऑल राइट. दैट कैन ऑल्सो डू. आई डू दैट ऑल्सो बिकॉज व्हेन आई सी when you see a burnout and you want to make sure that the caregiver is safe, and then you do that.
She is a mental health advocate, and she's asked,
Mm-hmm.
how can someone untrained in mental health counseling help someone who is struggling in the context of an emergent situation? For example, someone exhibiting signs of intent to self-harm and or attempt suicide.
Mm-hmm.
And I think there were some related questions. What are your opinions on psychiatric patients becoming mental health professionals in the future? Is there any scope, for this? Yeah.
So, depending on the skill, depending on the situation, even I may not be able to do the best job ever. Because it depends again from situation. And I'm being very humble here. I'm not saying, yeah, I know. That's exactly why I'm saying this. What we should do is create more awareness. Create more awareness at mental health advocates. Create more and more and more awareness. We should create awareness also of mental well-being. वी शुड नॉट जस्ट क्रिएट अवेयरनेस कि ये बीमारी है, वो बीमारी, ये सिम्टम्स है, वो सिम्टम्स है. सब सिम्टम्स पढ़ के लोगों को लग जाएगा. जो एंग्शियस लोग है ना, वो सिम्टम्स पढ़ते होंगे, लगे मुझे ये बीमारी भी, वो बीमारी है. So we should try and do a balancing act when we are doing mental health advocacy of creating awareness for mental health illnesses, how to identify and how to pick them, and also for how to have good mental well-being, especially in the digital age when we are always doing all this digital stuff. तो वो जरूरी है. इन यू सी ए पेशेंट इन क्राइसिस, साम दाम दंड भेद करके कैसे भी करके वी नीड टू कन्विंस दैट पर्सन नॉट टू हार्म देयर लाइव्स. So, so if you have to go out of your way to please that person, plead that person, say, cajole that person, because जो the suicidal ideation which comes, usually it comes as a emotional storm. So what happens when you're in a storm? Sometimes you just have to stay in the storm, just stick in the storm, just stay put, and the storm passes away. हम उस पेशेंट को उतना हैंड होल्डिंग कर लें, उसको समझा लें, उसको बैठ जाएं. I think in a few hours or few minutes to few hours, that storm will pass away, the person will calm down. I think that's what we should do if you see something like that. How that makes sense.
Yeah.
But this is again, we can only try, but this is the way out, because we should realize how brain works. Brain is never in the same. So high phases aate hain, low aate hain. So sometimes person is very disturbed, some event happened and person, okay, I'm just going to end my life now. And you by chance are next to it. You tell that person, nahi, nahi, chalo, I'm around you, let's do something, or try and divert the person's attention, I think. And if you wait for some time, I think that thing will pass away. And then you definitely take the patient to a psychiatrist so the medicines can be started.
Yeah. I think you can get certified as a suicide interventionalist, or even easier, like I have a certification in mental health first aid. तो उसमें कुछ ऐसे pointers बताते हैं. So this is the thing that you can do.
Yeah,
You're
maybe,
interested.
yeah. Because I'm a psychiatrist, मुझे लगता है सबको इतना तो पता ही होगा. That's true. I mean, you probably need that kind of training. That's true.
Right. Mm.
Can I also answer another question I saw of some people who have schizophrenia, they're both in the same family? I
Mm-hmm.
thought that was an important. I want to answer them. You know? So schizophrenics have got married, can get married, do get married. Schizophrenics had children, have children, will have children. So that both things can happen. मैंने शुरू में भी बोला था. I think I did. I tried
Yeah.
to try to tell that
Mm.
it depends again on the severity of the situation and so much other. See, if you are a family which has supportive environment, uh, there are the people to support that marriage. Excellent. Um, and depending on the spouse you get, depending on the chemistry between husband and wife, all that stuff happens helps in. So it's not a no that you can, just because you're diagnosed with schizophrenia you can never get married. But again, a lot of time people hide and get married.
Yeah.
You flip side of that, and that's very nasty for the other person, and it is very traumatic, and it does leads to a lot of problem. पुराने जमाने में जब people are not that aware, चल जाता था. लोग गांव में रह रहे हैं, अपनी किस्मत समझ के people used to do. But today it becomes a big problem. So don't hide. The, it's fine. You will find somebody. There are other people also who may have some other illness or may be very compassionate and love you and go for it. So you can definitely try and do that. But don't hide in marriage just because Dr. Vishal said कि marriage हो सकती है. That's not going to work out. Okay? And again, it depends on a lot of factors. So, so उसकी डिटेल में अगर मैं जाएं, suppose किसी को एक एपिसोड schizophrenia आया when the person was 20 years old, and that episode actually be triggered by cannabis induced psychosis था वो, और उसका treatment हुआ, patient became better within a month or 2 months. The patient said, I will not do any drug anymore in life ever. And person is stable, and we've seen patient for 5 years, 7 years, 10 years. कुछ नहीं हो रहा. Definitely that person get married. एक person को schizophrenia आया 18 में, उसको पहली बार ठीक होने में 6 महीने लग गए. फिर थोड़ा सा ठीक हुआ, डेफिसिट्स रह गए. फिर दोबारा एक्यूट एपिसोड आ गया, फिर एडमिशन हुआ, नहीं ठीक हुआ, टाइम लगा. उस person at 24, 25 could not complete college, no job. How do you get married? Not get married. See, you know what I'm saying? So I
Mm.
think it depends on a lot of factors, lot of factors. Again, family support, again. So multiple factors need to look into. So it's not a never know, but we need to look at all this. And this goes for not just schizophrenia, for all mental health problems,
Yeah.
all problems. It can be diabetes, it can be hypertension also. And
Mm. I think it's illegal by now. It's illegal to get into a marriage without disclosing.
yeah, तो वो होता ही है ना, बाद में फिर वो केस आते हैं,
हाँ.
cases होते हैं.
Yeah.
That becomes painful for everyone.
Yeah. Yeah.
But with that again, sorry to again extend, but this is Indian thing कि Indian parents, जब तक हमारे बच्चों की शादी नहीं होगी, so it's not a bad idea. But they want to make sure their children are settled. शादी नहीं होगी तो हम शांति से नहीं जा सकते, So that's our job. So I think that way a lot of family people get carried away. They get their kids married when they're not eligible. That also happens. So both things.
Hmm.
It's again, it's very nuanced. We need to look at it in multiple levels.
Mm-hmm. Yeah.
Because if I am the father, I have to also look from the perspective of a father who has a child who has this problem. मैं चला जाऊंगा, कौन उसका ध्यान रखेगा? So there's thinking from that angle. So it has to be looked into multiple levels.
Thank you so much, Dr. Chhabra, for all of your answers. I think हम काफी express mode में चल रहे थे. I am sorry that there wasn't a lot of breaks in between. I guess I was also, just wanting that the maximum people get benefit from this
No,
session.
it was very nice. I found this very nice that all the people who were there were participating actively, asking important questions,
Hmm.
and it felt not superfluous. They were asking from the deep experience. Everyone.
Thank you. Thank you so much
Okay.
for everything.
And thank you most of all, Avni, for arranging this talk and conducting it so nicely.